In each cardiac cycle, the atria and ventricles alternately contract and relax, and what they do, they basically force blood from areas of higher pressure to areas of lower pressure. So in a simple way, we say blood always flows from high pressure to low pressure. Recall that when a chamber of the heart contracts, pressure inside that chamber increases. And when a chamber of the heart relaxes, pressure inside the chamber drops. Also, we remember that when we want to refer to the contraction of a chamber of the heart, we refer to that as systole. And when we talk about relaxation of a chamber, we refer to that as diastolic. It is important to note that in an average size healthy adult at rest, one cardiac cycle is about 0.8 seconds. About half of this time is used for contraction of the chambers during systole, and half of this time is used for relaxation of the chambers, diastole. I would like to start with a phase in cardiac cycle, which is after ventricles ejected blood out, pushed blood out. Obviously, we know right ventricle pushes blood into pulmonary trunk, left ventricle pushes blood into aorta, and ventricles afterward relax. The moment that ventricles relax, the pressure inside the ventricles drops quickly. We get to a phase that pressure inside atria would be more than pressure inside ventricles. As soon as pressure inside atria is higher than pressure inside ventricles, both atrioventricular valves open. So tricuspid valve and bicuspid valve simultaneously open, and blood start flowing from high pressure, which would be inside atria, to low pressure inside ventricles. During this phase, please note the entire heart is relaxed. None of this chamber is contracting. During this phase, ventricles receive the most amount of blood from atria. We name this phase ventricular filling. So I start with the ventricular filling. Both AV valves are open. Blood flows from atria into the ventricles, and the entire heart is relaxed. When blood flows from atria into the ventricles, we get close to the period of time that the pressure in atria get very close to the pressure inside ventricles. In an attempt to push extra blood into the ventricles, what atria do, their walls start contracting. So this is the next phase, that atrial walls contract, and we say this is atrial systole. This is a very short phase. It just takes about 0.1 second, that would be 1/10 of a second, that atrial walls are contracting and forcing a little bit more volume of blood into the blood volume that we already have inside the ventricles. We call this phase atrial systole. So if I think about what is the difference between ventricular filling and atrial systole, the main difference is in ventricular filling, the entire heart is relaxed, but in atrial systole, atrial walls are contracting. Recall that during both phases, ventricles are receiving blood from atria. However, they receive more volume of blood during ventricular filling. During atrial systole, realistically speaking, when we are at rest, only about 25 milliliter of blood will be added to how much blood we have inside the ventricles. And please note that at the end of atrial systole, when atria are done contracting, ventricles are also done with their relaxation. So we can say that we're getting close to the end of ventricular diastole. And exactly at that moment that ventricles are done with their relaxation and very soon they're going to start contracting, when we measure the volume of blood that we have inside each ventricle, we see that each one of these ventricles contains about 130 milliliters of blood. And we name this volume of blood that we have inside each ventricle at the end of its relaxation, at the end of its diastole, and diastolic volume. I would like to emphasize that all the numbers that I use in this video applied to an average size healthy adult at rest. So at the end of atrial systole, we are done with receiving blood inside the ventricles. The next step is atrial walls relax and ventricular walls start contracting. As soon as ventricular walls start contracting, we switch to the next phase, which would be called ventricular systole. Ventricular systole takes about 0.3 seconds. As soon as ventricles contract, they push blood up, and due to the backflow of blood, AV valves quickly close. So we end up with a very short period of time that lasts just about 0.05 seconds. During this very short time, AV valves are closed and we have not opened the semilunar valves. So all 4 valves are closed. That's the main reason the volume of blood that we have inside the ventricles does not change. And that's exactly the name of this phase. We call this phase isovolumetric contraction. The ventricular walls contract, and basically the cardiac muscles are contracting. They're generating force and pushing blood up. However, they are not yet shortening. So due to the closure of all 4 valves, the volume of blood that we have inside the ventricle does not change during isovolumetric contraction. The contraction of ventricular walls continues. So pressure rises inside the ventricles, and eventually the pressure forces the 2 semilunar valves to open. That would be pulmonary semilunar valve, and this is aortic semilunar valve. It's important to note that how much blood pressure inside the ventricles rises to open the semilunar valves would be different depending on which side of the heart we are talking about. Inside the left ventricle, pressure has to exceed the pressure that we have in aorta in order to open aortic semilunar valve. At rest, we see that pressure inside the left ventricle should go above 80 millimeter of mercury in order to open aortic semilunar valve. But in the right ventricle, pressure has to exceed the pressure that we have in pulmonary trunk, which that's about 20 millimeter of mercury. So it means that in right ventricle, as soon as pressure rises above 20 millimeters of mercury, pulmonary semilunar valve opens. And as soon as the 2 semilunar valves open, which the opening of semilunar valves would be simultaneous, then ventricles continue their contraction to push blood out. And as soon as ventricles start ejecting blood into these 2 arteries, we name the phase ventricular ejection. Ventricular ejection lasts about 0.25 seconds, and during this period of time, obviously both semilunar valves are open and ventricles are pushing blood out. When we measure how much right ventricle pushes blood out into pulmonary trunk, we see that it's about 70 milliliter. And when we focus on how much blood left ventricle pushes into aorta, we see that it's the same volume, 70 milliliter of blood. We name the amount of blood that each ventricle pumps out during ventricular ejection stroke volume. So we say at rest, stroke volume of an average size adult is about 70 milliliters. So it simply means that at the end of their contraction, inside the ventricles, we are left with only 60 milliliters of blood. We name the volume of blood that is left inside each ventricle at the end of the contraction of the ventricle end systolic volume. So at the end of ventricular ejection, we are left with 60 milliliter of blood in each ventricle. As soon as ventricles relax, pressure inside ventricles drop very quickly. That's the moment that blood inside pulmonary trunk and aorta starts backflowing toward ventricles. And we know as soon as inside these arteries blood start backflowing toward the ventricles, semilunar valves close. So here we are at a phase that we just closed the semilunar valves and we have not opened the atrioventricular valves. So in short, All four valves are closed. However, please note, ventricles are relaxed. The volume of blood inside the ventricles does not change because none of this valve is open. So we name this phase isovolumetric relaxation. At the end of isovolumetric relaxation, we get to the point that pressure inside atria would be more than pressure inside the ventricles, which that means AV valves open and we start with ventricular filling again. This is a cycle, so it doesn't matter you start from which phase of this cycle, you always get back. And here it is important to note that using these AV valves and semilunar valves, the flow of blood into and out of ventricles would be regulated. It means that we have two phases that AV valves are open and let blood from atria flow into the ventricles. One would be ventricular filling and the other one would be atrial systole. During one phase, we open semilunar valves to let blood be pumped out of the ventricles. That phase would be ventricular ejection. Clearly, during the two isovolumetric phases, isovolumetric contraction and isovolumetric relaxation, all four valves are closed. So blood doesn't go inside ventricles and doesn't get out of the ventricles. So we regulate the timing that blood flows in or out of the ventricles. However, when we focus on the atria, we notice that atria always receive blood through the veins. The scientific reason is when we look at the opening of veins into atria, for example, that's the opening of superior vena cava, that's the opening of coronary sinus, this is the opening of inferior vena cava, so that's in right atrium, and when we look at the left atrium, we see the opening of four pulmonary veins. At the opening of these veins into the atria, we do not have any valve. So that simply means that those veins are open into the atria all the time. And that simply explains why atria always receive blood. Basically, during all phases of cardiac cycle that I talked about, atria keep receiving blood through these veins. I hope you find this information helpful.